Welcome to the HIPAA Privacy for Healthcare Providers course. As technology advances and medical records become easier to share, especially by electronic means, the potential for information leaks and abuses increases as well. In 1999, a Michigan-based health system accidentally posted the medical records of thousands of patients on the Internet. That same year, the health insurance claims forms of thousands of patients blew out of a truck on its way to a recycling center in East Hartford, Connecticut. Think for a moment. How would you feel if, without your permission, your medical information were passed on to a lender who could then deny your application for a home mortgage, or to a prospective employer who could use such information to make hiring decisions? Or let's say a few weeks after you see a doctor for some routine tests, you receive a letter from a drug company promoting a treatment for your high cholesterol. How important is the privacy of your personal health information? The Health Insurance Portability and Accountability Act, HIPAA, of 1996 recognized the need for the protection of private health information. Congress recognized that advances in electronic technology could erode the privacy of health information. Consequently, Congress incorporated into HIPAA provisions that mandated the adoption of federal privacy protections for individually identifiable health information either by congressional action or, if Congress did not act, through regulations adopted by HHS. Because Congress could not agree on a health information privacy law, HHS was mandated to issue regulations under the authority granted by HIPAA. The final HIPAA Privacy Rule was published in August 2002. Provisions that have already been in effect for several years were designed to expand access to health insurance coverage. The administrative simplification provisions of the bill required the Department of Health and Human Services, HHS, to adopt national standards for electronic healthcare transactions to make the system more efficient. HIPAA legislation covers three areas: portability, accountability, and administrative simplification. The portability component makes it easier for people to move from one health insurance plan to another as they change jobs or become unemployed. It provides continuity of coverage by limiting the circumstances under which an individual can be denied benefits because of pre-existing condition clauses. Accountability significantly increases the federal government's fraud enforcement authority in many different areas. These first two provisions have already been in effect for several years. The third component, administrative simplification, received little attention when the law was first enacted because of its delayed implementation date. But since their implementation in April 2003, the privacy regulations under this component have generated much discussion and debate and are the focus of this training.